Hi everyone, my name is Saleha Singh and welcome to the first episode of Gupshup with Saleha. Beginning this week, we are going to have a catch up every Wednesday and we are going to bring you topical issues and discuss that with a subject matter expert. So if you would like us to discuss anything that is of importance to you, please get in touch with us. I think we're pretty sorted for the next 2 weeks. Isn't it, Kunal, Manish? Yeah, they are nodding. You just can't see them. So anything else that you would like us to discuss in the next couple of weeks, we are happy to go ahead and do that. How are you guys? Going out only for essentials, social distancing, wearing a mask? I've been wearing a mask since last week, since the government has told us to do so. But you know what? When I went shopping last week, most of the people I met, they weren't wearing masks. So while I'm doing the right thing by the government, many aren't. And I'm trying to keep myself safe, my family safe, and others safe. My guest tonight is Dr. Kaushik Banerjea, Executive Director, Medical Services. Kaushik did his MBBS from India. He worked in India, in the UK, the Caribbean. Can you imagine? He worked in the Caribbean. How cool is that? And then he moved to Australia. Hi, Kaushik. How are you? Good to see you.
Good to see you too, Saleha.
So thank you for coming to my first show.
Not at all. Not at all. You're very welcome.
And before I start with the questions that I've received from friends and some viewers, can you please tell us a little about yourself, please? Thank you.
Well, I think you've already said it. So, yes, I did my medicine back in India quite a few moons ago. And subsequent to that, I did a 5-year stint in the Indian Army. Most exciting part of that was spending over 2 years in a high altitude area in Sikkim. There was very little work to do from a doctor perspective because everybody under my care was the fittest and the brightest people in the army.
Oh, you're very bright.
But what I also did at that time was I spent some time with my hobbies, and particularly photography. And not hesitant to say that I possibly have one of the best collection of high altitude flowers, which often come up only for a couple of days every year.
Have to see that next time.
Oh, most certainly, you're welcome. After that, I left India, went off to the UK. I have to admit that the weather in the UK was not the best. So decided to
Melbourne, yes.
So I moved down to the Caribbean. Can't complain about the weather or the beauty of the place in general. Yes, you're not the first one who's talked about me being in the Caribbean. I mean, but you got to think about it. Somebody's got to do it.
Of course, and why not you? Yes.
So I did that. Spent glorious 8 years in the Caribbean. That is where I did my post-graduation as well. I'm an emergency specialist and then continued to work as an emergency specialist for many, many years. Came to Australia in about 2005 and since then have worked in different states in Australia. Over the last 4 years, I've moved almost totally into medical administration. As a specialty and as a role. And that's what I'm doing now.
Okay. Thank you, Kaushik. So I'm going to ask you a few questions that have come in.
Sure.
Okay. Can you please explain the coronavirus in a layman's term?
Wow. With all that stuff that's going on in the media.
Too much information in the media.
Okay, so very, very basic stuff. There are pathogens in the environment which cause diseases in humans. broad classification: bacteria, viruses, fungi. So this particular one that we're talking about is a virus. It is similar to another virus which we have heard about before, the SARS virus.
Yeah.
This one was unknown to mankind till about December of last year. So the official name of this virus is SARS-CoV-19. The SARS component of that name comes from the fact that it is very similar in structure to the SARS virus. The CoV is a contraction of COVID.
Yeah.
It is the coronavirus causing disease. So that's where COVID comes from.
Yeah.
And the 19 component is because it was identified in 2019.
Okay. Yeah.
So the official name is SARS-CoV-19. And the disease it causes is the COVID-19 disease process that we are all familiar with now. It's a small little virus, like usually viruses are. The big difference of this particular virus compared to the others that we have seen in the past is its extreme level of virulence. It is very, very infective. It spreads very easily, and it causes significant serious concerns once it gets inside the human body.
Okay.
I think we'll stop it at that. Yeah.
Yeah. Okay. I have a question from a viewer which says, "Can you please tell me what are the symptoms?"
Okay, sure.
Yeah.
So right at the very beginning, when the virus was identified in Wuhan, in China,
yeah,
we at that point we were talking about some common symptoms, which would be fever, sore throat, a cough, maybe some chills associated with general body ache. Subsequently, we have also recognized that it can cause a multitude of other symptoms.
yeah,
Interesting ones are the loss of taste or the loss of smell. We have also seen people who develop some sort of a diarrheal symptom with it. Of course, the usual runny nose, stuffy nose, shortness of breath are common as well.
okay, yeah.
It can go into some, in the later stages, it can cause some other symptoms, but I think we'll stop that.
Leave it at that. Okay.
Yeah.
Another question is that what do you think each one of us should do and not do? And the reason I ask is, Kaushik, sorry. The reason I ask is that this morning in the ABC, one of the epidemiologists said that the messages are not getting across, and many think it's a mild disease. It is not a mild disease, is it?
It is interesting that you asked that question, because if we look at what this virus does, and we look at across the spectrum, then it can be a reasonably mild disease in a significant proportion of the population, particularly kids. It produces very mild symptoms or no symptoms whatsoever. Similarly, younger adults don't see a terrible problem with this virus. Unfortunately, the elderly don't have that sort of a wonderful time with it. They do tend to get sick, and sometimes very sick. If the elderly also has some other disease processes going on, for example, they have a chronic lung disease or a heart disease or high blood pressure or diabetes, which are pretty common in the elderly population anyway, they tend to get the worst version of this virus and its effects. The problem that we usually associate with this virus is when people die. The vast majority of people who have died because of this virus is primarily because the health system was overwhelmed with the large number of patients and could not cope. It doesn't need any specific exotic treatment. It needs basic supportive treatment in the most cases. Yes, some people will need oxygen supplementation, therefore ventilators, therefore ICU admissions, and so on. But the vast majority of people don't actually need that. So once we start equating the virus to the deaths it causes, the death is, as I said, it's a function of the health system being overwhelmed. If the health system is not overwhelmed, then the number of deaths is actually pretty low.
Okay.
So it is actually problematic because it spreads very quickly. And if it spreads from one person to the other very, very quickly, then we have a problem that the number of cases that come up may very quickly overwhelm the health system. Happened in places like in Spain, in Italy, in the UK for a while, in the US, particularly in New York, and now getting on to Florida. So that's the kind of thing that happens. Now, in Australia, we have been reasonably fortunate and careful that we have been able to control the disease in that space where it didn't go into that kind of numbers, and our health system was equipped to handle. So if you look at the death rate in Australia, it's significantly low. Well, the death rates in New York were significantly high, as was in Italy or in Spain.
Of course, yes. So here's a question from a viewer. Should we all be wearing a mask, and how effective is a mask in reducing transmission? This is a conversation you and I have had over the last few weeks. Yes.
Absolutely. And that is possibly a wonderful way to start that answer, because the fact that we've been talking about it for weeks shows how much complexity is there in the answer for this question. It's not a simple answer of yes or no.
Yeah. So, yeah.
If we actually think back as to how this virus is actually spread, the major mode of transmission of this virus is by what we call droplets. So we cough, we sneeze, droplets come out of our mouth. That's the virus. Yes. These droplets are significant size that gravity actually has an effect on it, and it pulls it down to the ground within about a meter of leaving our mouth. Which is basically why we talk about keeping the spatial distance of 1.5 meters.
Of course.
Because the vast majority of these droplets will actually settle on the ground or on the tabletop or wherever it settles, yes, because of gravity. Which means that then our ways or modalities that we can use not to pick up that virus is that we maintain our hand hygiene. So anytime we are touching a surface which I don't know who has coughed or sneezed on it,
yes,
or a doorknob that somebody else has touched, I need to be critically careful about sanitizing and cleaning my hands. And if I don't do that, and I touch my face or my nose, then I'm actually transferring the virus from the tabletop,
yes,
to my face or nose. That's where the majority of the virus gets in.
Of course.
There is a second type of transmission as well, which we call the airborne transmission.
Yes.
The airborne transmission happens because some virus particles actually come out of a significantly smaller size. They are so small that the gravity has minimal effect on it. Therefore, it stays in the atmosphere, it kind of floats around. And once it floats around, it can float around for a long time, depending on how the room is ventilated, or if you are out in the open, in a park, for example, then even if it's floating around, it gets diluted. That doesn't obviously happen if you're inside a room with 5 other people.
Yes.
So once we understand these two basic modalities of transfer of this virus from one person to another, now we can think about how does the mask actually help. So the first thing that the mask does is it covers your face, your mouth, and your nose, the two major portals of entry for the virus.
Yes.
we may not realize it, but we touch our face subconsciously, unconsciously, far too many times in our daily life.
I
We
am
don't
guilty
recognize.
of that. Yes, I do it all the time.
We all
Yes.
do. We all do. Don't beat yourself up, Saleha. We all do. And so if you actually have a barrier like a mask, then even if you inadvertently touch your face, you are not touching directly your mouth or your nose. You've got a barrier there. That's the mask.
Okay, yes.
So that is one way the mask actually helps in preventing the transmission. The second thing is that when I am coughing or sneezing, there is still that 1.5 meters that this droplet can travel. So if somebody is within that space, yes, I can infect that person. So if I have a mask on, then I keep my viruses to myself. I don't sneeze it on somebody else.
So being mindful.
Being mindful. So that's the second way the mask can help. The third thing, which is possibly becoming more common now, is to understand something about it's actually called the prevention paradox. So what that talks about is that the individual person's benefit of wearing a mask may not be huge. It's like seatbelts. I use a seatbelt when I'm in a car. Now, my individual improvement in longevity because I'm wearing a seatbelt is possibly not that great. But when we put it in a community,
yes,
it has an impact which is way beyond the total numbers.
Yeah.
In a similar vein, when we are using mask and when everybody is using mask, that is what we are talking about. The mass masking talks about that kind of a community benefit. There is also the third and the fourth version of what type of mask that you wear and when do you wear it and what needs to be done. And those are possibly a little more detailed conversations. And if we have time, we can always come back to it.
Yes.
But I'll probably leave it here for the time being.
Okay. So Shivani Gupta wants to know, why is there such a discrepancy in the way young people who are infected behave? Some have symptoms while some don't. Young people have also passed away overseas.
Absolutely. There is some idea that we have about why this difference occurs, but we don't know a lot. And the health scientists all over the world are working on it. We are learning about this virus every day. So we do know little bits like some hormones in the body, particularly the female type of hormone seems to have a protective kind of an effect when the body is infected with this virus, which is possibly why it is believed that very young kids who still have remnants of the female hormones from the mother are kind of protected. Kind of.
Yes.
There's also been a recent study which showed that people who are bald tend to get worse outcomes with this virus. And again, it's been related.
That's
now, don't take it off to think that.
I know.
But basically, the point that they tried to discern from there was that it may be that because of the higher male type of hormones, which we know exists in people who are bald, necessarily means that their female type of hormones is lower. So they're losing that bit of protective element that may have been there. Now, obviously, there's far more research needs to be done on this before we can say it for certain. At this point, we know that this is an association. We can't ascribe a causality to it. So we can't say this causes this. We have found this association.
Okay. Another question that's come through is, if I develop flu-like symptoms, what should I do? should I book an appointment with my GP or should I get tested? And here's my question to you is that I came from India in March and I
Yes.
traveled for 2 weeks all over India. So, when the government started testing, I was the first one to go in and got myself tested. But it's also the flu season. So
Absolutely.
if I get a headache or if I get a cold and I've already had a flu shot yesterday, should I get retested, Kaushik? What do you think?
Absolutely. In the present situation that we have in Victoria, we are actually recommending, the government is recommending that if you have the mildest of symptoms, you should go and get tested. Most of the testing is being done by testing clinics.
Yes.
Not very many GPs are actually conducting the test. Some do.
Yes.
Most of the time, if you actually call up a GP's office, they will possibly direct you to the nearest fever clinic
Yes.
to get tested.
Yes.
So absolutely, yes. Mildest of symptoms should get yourself tested. You are absolutely right. This is also the flu season. So the chances are that you're far more likely to have the flu than COVID-19.
Yes.
But you don't know that unless you have it tested.
Yeah. So everyone should get tested.
Mildest of symptoms, get yourself tested, please.
Okay. Ravina Singh wants to know, is there anything that she can take, vitamins or medication, to prevent getting this disease?
The answer to this is available on WhatsApp.
Yes. WhatsApp University has been in full form. Between media and WhatsApp University, we are inundated with information. And I think that's doing a lot of harm, isn't it?
My ardent request to all of you out there, and Ravina, you too, please do not take any cognizance of information that seems to come out like this. There might be some one odd bits of information that is valid, it is evidence-based. The vast majority is not. So all sorts of things like drink hot water or etc. Sorry, it's just not evidence-based. Just like the assumption that the warm weather will kill the virus.
Yes.
And therefore keep yourself hot. No, it doesn't work like that. What we can do in general is to try and prevent ourselves from getting infected. And that we can do by some very simple measures. Maintain distance from other people. 1.5 meters is what we talk about. If you are in a room with other people, then try and definitely wear a mask, because we're talking about the viral load in the environment gets higher and higher. The overall basic cough, sneeze etiquette, where you cough into the crook of your elbow, is definitely on. But just be sensible. It is not rocket science how we can prevent this infection from getting to us.
Kaushik, one last question. This
Sure.
is from my daughter, Samira. Thanks, Sammy. I feel your love. This is for people like you and me, Kaushik. It says, how important are dinner parties? What is the minimum amount allowed per week? I am not meeting anybody, Sammy. Not meeting anybody. Haven't met anyone. Haven't met Kaushik for 4 months. Have I? So, no, not meeting anybody, but Kaushik, it's all yours.
I like the way Sammy has asked the question, what is the minimum dinner amount?
Minimum number allowed per week, yes.
Honestly, the idea, I mean, if you just go back and think about how the virus spreads, common sense very clearly tells us that the more you can maintain your distance, the safer you are.
Yes.
And I prefer not to use the phrase social distancing. You don't have to be socially distant. You need to have spatial distance. So maintain that space distance, but be as social as you want to be, not actually sitting next to each other and sharing the wonderful KFC that, no, sorry.
Yes, no.
I take that back, Saleha.
Read
Not
about
KFC.
no parties at home until everything is back to normal. And Sammy, no, we're not having any dinner parties at home. No friends are coming, nothing. So thanks, Kaushik. It's been really great chatting with you. Thank you for coming to my first program and being my first guest. And
Glad to be here.
Yeah. Thank you, listeners. I hope you found this program useful and helpful. Do show me some love with a wave, with a like, with love, any emojis that you think is good for me. And I'll see you all next week with another round of Gupshup. In the meantime, take care, stay safe, be kind. Bye, Melbourne. Good night. Bye, Kaushik. Bye.